Hi there, fellow pregnant women. I'm Kara Westervelt Parker, and I'm here to talk to you today about why you should care about your fitness in pregnancy. I'm currently 31 weeks pregnant right now with my third baby. The first time I was pregnant, I did all the research and I had a perfect idea about what I should and shouldn't do for a fit pregnancy, but putting it into practice for my first pregnancy was harder than I expected. I had a better go the second time around with my fitness, mostly because I knew what to expect as far as those things that work against your motivation. And truly, ladies, the hardest part is finding your motivation. You are not going to feel like exercising. I suppose this is true for fitness for anybody at any stage of life. Getting in shape is just hard. And it's extra hard to feel like working out while you're growing another human being. Honestly, getting the sports bra on and off alone seems like a valid excuse to skip a workout. There are some pretty good reasons why you don't feel motivated to exercise, and I'll talk about those in the next few slides. When you first get pregnant, the dominant hormone coursing through your body is progesterone. This is the hormone that supports the lining of the uterus in your first trimester of pregnancy before your placenta takes over that job. Without high enough levels of progesterone, your body couldn't sustain a pregnancy, so it really has to crank up the progesterone to make sure your embryo stays in there and keeps growing. But that amped up progesterone also makes you very tired, like go to bed at 7 p.m. tired. And who wants to work out when they're that tired? If you're like me, you had constant nausea through the first trimester. But interestingly enough, when I exercised in the first trimester, even with nausea, the exercise made it go away. Or it made me forget about it for a while anyway. Either way, nausea didn't really affect my actual experience while I was working out. Even though it seems counterintuitive to go for a run or a walk if you feel like puking, just give it a try. It actually worked for me. So the first time I was pregnant, I was paranoid about doing anything that would cause a miscarriage. I remember asking my OB if it would be okay if I went on a water slide during my first trimester, or if that would put the baby in danger. Her answer to me was that I would literally have to break my pelvis to endanger my fetus. And that really does make sense. Your baby in the first trimester gets no bigger than a lime, and your pelvis acts as a lovely cage for it and all the fluids and tissue that are supporting your pregnancy. Whether or not you miscarry is not related at all to exercise. As you go along in your pregnancy and keep gaining weight, you're going to have joint pain, especially in your hips. And it's not just the extra weight either. You also have a hormone in your body called relaxin that causes your joints to get all loosey-goosey. This helps your pelvis get wider in preparation for birth, but it also makes your joints feel really strange, which can affect how you feel during exercising. So now I've told you all the reasons why you won't want to exercise while pregnant, and as I mentioned, they are many and they are compelling. But hear me out. You have got a big day coming up. Labor is unlike any other physical endeavor, but it's similar to other things in that if you have physically prepared for it, it's easier than it otherwise would be. I'm not going to lie, childbirth is pretty painful and exhausting, but having prepped for it by exercising will make it more bearable, both mentally and physically. You're definitely going to gain weight in pregnancy, but putting too much on can tax your body and just make you feel more sluggish and uncomfortable than you already are. Exercise is going to help with that. Exercise also helps your body with blood sugar levels. I won't get into the details of gestational diabetes here, as your doctor probably already has told you about it, but exercise helps with processing glucose in your blood. So I've had pregnancy insomnia with all my pregnancies, and it is miserable. Not being able to fall asleep or waking up in the middle of the night and not being able to get back to sleep is a really obnoxious way to live. I hate it. And you know what helps? Exercise. If I exert enough energy in the day, I literally cannot stay awake at night. It's a pretty nice side effect of getting my heart rate up a little during the day. Probably my favorite aspect about exercising during pregnancy is that it just makes me feel like a boss. There's so much that happens to your body during pregnancy that you cannot control, and it can be a little demoralizing, honestly. It just feels good mentally and emotionally to be in control of your body in that moment. Now, if this is your first pregnancy, you may not have firsthand experience with how important pelvic floor health is, but trust me on this one. I paid zero attention to this aspect of my fitness the first time around, and I peed when I sneezed or laughed too hard or lifted something heavy for months after giving birth. Doctors recommend pelvic floor exercises during and after pregnancy. Do not wait until you are peeing yourself to do your Kegels. You don't even have to put on a sports bra to do it. So, what's the best way to get your sweat on when you're tired and nauseated and in pain and feeling giant? Well, I am glad that you asked. Walking is great. It's really easy to incorporate a 10 or 20-minute walk into your daily routine without having to go through the rigmarole of changing into workout clothes. Just put on some sneakers and go. Swimming is another popular option for pregnant women. The feeling of buoyancy is awesome when you're used to feeling so heavy all the time, and it's zero impact on your joints. Yoga is also pretty popular with pregnant women these days, although some poses in late pregnancy are off limits because they involve lying on your stomach or your back. Any kind of stretching or body resistance work is great. You can also work up a nice sweat doing a spin class. It's not personally my thing, but lots of women swear by it because it's low impact on your joints and you can still get your heart rate up pretty good. And do not forget those Kegels, ladies. Are there things you shouldn't do activity-wise when you're pregnant? Definitely, but luckily the list is short and very manageable. Don't get dehydrated or overheated. You can get your heart rate up, but don't work too hard. Overheating is bad for the baby, which is why your doctor told you not to go into hot tubs or saunas while pregnant. Drink lots of water when you work out. Don't do high-contact sports like hockey or soccer. Don't lift super heavy weights. It could send you into early labor. And last but not least, you can't do stuff where you have to lie on your stomach, which is kind of a duh thing to say, but nonetheless I'm saying it. Lying on your back is also something you shouldn't be doing during the course of exercising. So that's about it for pregnancy and exercise. I find most of it to be common sense, and I hope you do too, but if you want more information about what I've talked about today, these are my sources, and they're all more expert on the topic than I am. I've also given credit for the photographs I've used. I hope you have a great rest of your pregnancy and are able to get some fitness in there, even when you don't feel like putting on that sports bra. Thanks.